Hello and welcome to this information video about developing an awareness of the specific condition of autism. My name is Andrew Middleton and I'm the Inclusion Manager at ISS. So, autism is a developmental disability caused by differences in the brain. People with autism may behave, communicate, interact and learn in ways that are different from most other people. And the abilities of people diagnosed with autism can vary. For example, some may have advanced conversation skills, whereas others can be non-verbal. There's a big continuum between all the different aspects of autism. Autism will begin before the age of 3 years, and it can last throughout a person's life, although the symptoms may improve over time. So, for diagnosing autism, some children will show symptoms in their first 12 months, and in others, symptoms might not show until 24 months or even later in life. People with autism will often have problems with their social communication and interactions, and restricted or repetitive behaviours or interests. And these characteristics can make life very challenging. It's important to note that some people without autism can also show some of these symptoms. There's no medical test, like a blood test, that can diagnose the disorder. Professionals will look at the child's behaviour and their development in order to make a diagnosis. And by the age of 2, diagnosis by an experienced professional can be considered reliable. However, many children might not receive a final diagnosis until they are much older. So, some useful strategies when working with young people with autism. As I've said, each individual is very different and they will need a personalised set of strategies to help them, depending on their needs and depending on their abilities. Some of the main areas of intervention include behavioural, developmental, social-relational, and psychological. We'll look at each one of those four in a little bit more detail. Behavioural interventions will focus on changing behaviours by helping the young person to understand what happens before and what happens after the behaviour, as well as understanding the behaviour itself. And a notable behavioural treatment for young people with autism is called Applied Behaviour Analysis, or ABA. This encourages the desired behaviours and discourages undesired behaviours for young people that struggle to understand the difference between the two. Developmental interventions focus on improving specific developmental skills such as language or the physical skills. And the most common developmental therapy for young people with autism is speech and language therapy. This helps to improve the person's understanding and use of speech and language, although some people diagnosed with autism communicate verbally very well. Another one is occupational therapy, and this aims to teach the skills that help the young person to live as independently as possible. Skills can include dressing, eating, bathing, and relating to people. Social-relational interventions focus on improving the social skills of young people with autism and helping them to build emotional bonds. Some social-relational approaches will hope to involve parents or peer mentors to help. One aspect of this will be through social stories. These provide simple descriptions of writing and in pictures of what to expect in different social situations, and also social skills groups, or groups that provide opportunities for young people with autism to practice their social skills in a structured, safe environment. Psychological interventions can help young people with autism to cope with anxiety, depression, and other mental health issues which the condition can unfortunately bring with it. Cognitive behaviour therapy, or CBT, is one psychological approach that focuses on learning the connections between their thoughts, their feelings, and their behaviours. And during CBT, a therapist and the individual work together to identify goals and then change how the young person thinks about a situation to change how they actually react in that situation. So there's a lot of further information available with regards to autism. There's Autism Seychelles, based here on the island. So they have their own Facebook page at the top, and you can contact them by email. There's also lots of other resources available throughout the internet to understand autism and to support the parents of young people diagnosed with the condition. Thank you very much for listening and watching this presentation, and I hope you found it useful. Thank you.